Good afternoon. We start with breaking news this hour. Scientists stress that more research is required, but early findings from Public Health England suggest that vaccines might not be effective in reducing the transmissibility of the Delta variant of coronavirus. Well, let's cross straight away to our health correspondent, Ashish Joshi, who can give us more information on this. Ashish, just how worried do we need to be?
At the moment, just a little concerned, I think. I've spoken to the people at Public Health England this morning, and they are keen to stress these are very early findings. These are the initial findings, and a lot more research needs to be carried out to see exactly what this means, the long-term implications for the vaccine and for the Delta variant. This is the weekly technical briefing. This is what the PHE scientists have found out, and they make it public. And during the course of their research, they found that, and I'll read to you from the Public Health England guidance, they said that they found from their initial research that levels of the virus in those who become infected with Delta, having already been vaccinated, might be similar to levels found in unvaccinated people. Essentially, what that means is that's the viral load, the levels of the virus contained within a person. Now, if they're the same, if you're vaccinated or unvaccinated, that might impact the transmissibility of that virus, i.e. the ability to pass on that virus to another person. If you've been vaccinated, we have been told all along, and the research has found that the vaccines reduce transmissibility. Now, these initial findings seeming to suggest that they might not be as effective as once believed. I do stress this is very early days, these initial findings, and a lot more research needs to be carried out. But this is something that will concern the scientists and the vaccinologists who have always said that the transmissibility is greatly reduced by having 2 doses of the vaccine. Initial findings seeming to suggest that the viral loads in people could be similar for the Delta variant, whether vaccinated or unvaccinated.
Just while you've been speaking, Ashish, we've had some breaking news drop from the ONS with a new figure that an estimated 1 in 75 people in England have had coronavirus in the latest week of data. The last figure we had for that was 1 in 65. So 1 in 75 people in England with COVID this week compared to 1 in 65 last week. What do you make of that?
Well, that's better news. It means that we might be seeing the virus, the impact of the virus and the spread of the virus being curtailed. Right? We know that there's been a huge effort to try and get the vaccination levels up. We know that the vaccination levels will have an impact on the spread of the virus, but certainly this seems to be going the way we had hoped it might. And that is promising news. We did see early signs of it. We see it every day in the numbers of people. New infections, new cases are beginning to fall. We had that week where they fell every single day for 7 days consecutively. And this is good because if you look at the context and the warnings which were sounded by the health secretary and the government about the peak being mid-August when we could see 100,000 cases per day, that hasn't thankfully happened. So certainly the figures going in the right direction.